The question is there an ongoing benefit of using the medication, and does that benefit outweigh potential risk? So if the benefit is potentially going down as you age, and if the risk is potentially going up as you age, those lines may cross where you don't really see that the benefits outweigh the risks, in which case, especially with extremely expensive medications, such as in our world, it will at least be the impetus to us to say, we should do a study to try and figure this out, and that's what we're doing now with Disco MS. In 3 years, we'll have data that will say one thing or another, or perhaps something in between. So we may be able to see in a relatively restricted group of people, because this is people 55 and older who have been inactive, no scan change or no relapse for at least 5 years while continuously taking one of the approved disease-modifying therapies. So at least in that group of people who we think are relatively low risk for recurrence of disease activity, we'll either be able to say, A, that that's true, when they go off they do okay, no different from people that stay on, or B, that maybe they do significantly worse for whatever reason when they go off, or perhaps C, they might do a little bit worse. Maybe there's a slightly increased risk of having a small scan change, and then the patient will have to say, well, is that enough for me to continue to use the medication over a prolonged period of time? And so we may get sort of an in-between answer, and that's where the patient-reported outcomes, and that's where other data and asking a simple question, do you feel better, worse, or about the same now as when you started the study with regard to your relationship with the drug? That is, are you happier being on the drug if you're still on it, or off if you're off it? And what is the nature of that relationship now over a 2-year period of time? And it could be that people have a little bit of new disease activity, but they feel so much better being off of the medication, and you could look at that as less cost, less side effects, whatever else it might be, that they're willing to make that trade-off. It's not for us to decide, what they should view as a trade-off. None of the drugs that we use are perfect. None of them stop all of disease activity, so we know there's going to be some level of disease activity with many of these drugs, even as people age. So it might well be that we don't hit a perfect, no disease activity outcome, and yet people still find that that is acceptable to them and they would like to stay off medication.